Hello friends, today we are going to find the answer for what is black fungus. So we all know that India is being affected by this fungal infection. Let's take a closer look at this. Black fungus is a fungal infection. It could be like serious but rare. And it is caused by a group of mold called mucormycetes. Black fungus is also known as mucormycosis. So in this video, we'll be discussing about the causes of this fungal infection, what are the symptoms, people who are at risk, what is the prevention, and the available treatment options. So first, let's take a look at the causes. So the main cause is soil or decaying organic matter. So when we are in close contact with soil or decaying organic matter, we might get infected by this fungal infection. The second cause could be inhaling fungal spores from the air. When the air is contaminated with fungal spores, we might get infected by this disease. And also when we have certain type of skin injuries like cut or burns, then also we might get this disease. Then we have to take the look at the symptoms. So the symptoms depend on the area of the body where this fungus is growing. But there are certain common symptoms like facial swelling, fever, heaviness below the eyes or redness in the eyes or nose, impaired vision if you are unable to look clearly, severe pain, headache, black lesions in the mouth, like in your tongue, gums, anywhere. These are the most common symptoms. So now let's see who are at risk. So although so many people are here, it doesn't mean that we all will get infected by this fungal infection. People who have weakened immune system are more susceptible for this disease. So like, for example, diabetes patients, cancer patients, like people who got organ transplants, especially why this matter is being more popular and being discussed these days is because of COVID-19. We all know that COVID-19 will weaken our immune system. So people who have COVID or who had COVID might be at risk for this disease. So how can we prevent? So if it is a serious disease, then how can we prevent this disease? Prevention is, as I said, like mainly while we have contact with soil related things, we might get infected. So what we can do is we might wear shoes, long trousers, long sleeve shirts, and of course gloves while handling garden soil, moss, or manure. Then, as I said, while we inhale the air which has this fungal spores, then also we might get this fungal infection. So use of clean or sterile water for humidifiers during the oxygen therapies, and of course for ventilators, we might use clean ventilators. If not, it might have certain fungal spores. So then when we use it, like when we use the ventilators or when we use the humidifiers, we might get this infection. Use of masks. It is compulsory, and also we should use clean masks. If we use a mask, we should immediately wash it, and also we should dry it properly. If not, it might have that fungal mold. So we should use masks, of course, whenever we go out, and also we should use clean masks because masks could also have this fungal spores. Then we should maintain some personal hygiene. Like we should clean ourselves and we should clean our mouth. We should maintain a good mouth hygiene so that we can prevent this fungal infection, which is called black fungus. So, in case after we try to do all these measures and still if we get this disease, there are certain treatment options. If the disease is diagnosed early, like as I said, when you develop certain symptoms like fever, black lesions in mouth, like impaired vision, something like that, certain symptoms, if we immediately consult a doctor, then we might get antifungal medicine and we might treat ourselves. If not, if like as we inhale this contaminated air and it leads to the lungs, or it might be in your nasal ways, anywhere in your respiratory tract. And also, as I said, when you develop certain burns or certain skin injuries, you might get this in your skin as well. So, like in that case, if you develop any kind of black color lesions, then what will happen is we have to cut away the infected tissue, because if not, it might spread. So if it spreads, like for example, it might spread to our blood vessels, and blood vessels take blood to our brain. So if our brain is infected, over 50% possibility, like fatality rate is over 50%. So immediately we should cut away the infected tissue. Eyes might also get infected. So what we do is we remove the eyes. So this is how this disease is treated. So what we looked in this video is what really this black fungus is, and we looked at the causes, symptoms, who the people are at risk, what are the prevention methods, and also we looked at the treatment options as well. Thank you so much for listening. I hope you get some idea about black fungus after watching this video. So stay safe at your homes and bye.